Lots of people love to garden, but if you're suffering from joint pain, it can be a big problem. So where do you go? Well, in Philadelphia, the place to go is the Rothman Institute. They are known around the world as experts in joint replacement. Joining me today, Dr. Matt Austin, Chief of Hip and Knee Service at the Rothman Institute, and Diane Casey, who earlier this year had not one, but two knees replaced. How are you doing, Diane?
I'm doing very well.
Did you have them replaced at the same time?
No, about 3 months apart. I had one done in February and one done in May.
Were you surprised at how quickly you've recovered and now can get around?
Yes, I'm walking with no limp and no pain.
Now, in the beginning, you were not trying to have hip or knee replacement here. You tried other options, didn't you?
Yes, I did. I tried the cortisone shots. I tried the gel shots. First round, they worked. I was pain-free for 8 months. Second time around, the pain just would not go away. So Rothman sent me to Dr. Austin for surgery.
Well, no surprise that you turned to the Rothman Institute. What did you see in Diane's case, Matt?
Well, when Diane came into the office, she was in just awful pain, and she had, as she said, tried a lot of non-operative treatment modalities, which is our first thing that we always try. But her quality of life was so reduced that we talked over the options, and she decided to go ahead with getting both knees done, but separately.
And how typical is this scenario Diane's scenario for people that might be suffering from the same thing?
Oh, it's a very common problem. Millions and millions of Americans suffer from arthritis. Not all of them, of course, come to surgery, but about 500,000 patients require joint replacements a year in this country, and that number is only going to go up.
Now, show us exactly what you did with her knees.
Sure. The knee replacement is really not a knee transplant. We basically resurface the bones. We take very little bone of hers, and what we do is we resurface it with a cap that goes on the femur. There's a cap that goes on the top of the tibia, which is your leg bone, and there's a button that goes on the back of the kneecap, which is not shown in this model. And it basically articulates like your normal knee. And in 95% of cases, it returns patients to their quality of life, which is really what the aim is.
And is this something that will last for a long time?
This should last her anywhere between 10 and 20 years. It's variable due to a lot of factors, but 10 to 20 years is generally what we tell patients these days.
Diane, how much easier is it for you now to get around?
Oh, well, a lot easier. I had stopped going to the market. Every point in my life was how many steps would it take? Girlfriends want to go to the movies. Oh my God, how many steps is it to get there? I can't do it. It's too many. So you stop doing anything. I'm already going back to the movies. I'm going out to dinner. So my quality of life is definitely back.
So you're really happy you went to the Rothman Institute?
I'm very happy. And I adore Dr. Austin.
No surprise. So if people have joint pain, and there's a lot of joint pain, I even have joint pain, but I don't think I'm ready for hip and knee replacement. How do you know when it's time to come to the Rothman Institute?
Sure. Well, you don't have to come to the Rothman Institute just if you need a replacement. We have a full range of services. If you have some knee pain and just want to get it evaluated, we often start with anti-inflammatory medications, rest, modifying your activities, injections. These often spare patients for surgery, if not forever, for many years, and delay the need for surgery. So surgery is definitely not the first option.
Good information. Dr. Matt Austin, thank you so much for being here.
Thank you so much.
Diane, congratulations. Glad to see you doing so well.